But we just talked about your heritage in Mexico quite a bit. And I wanted to transition to you talking about your accident
Yes.
and educating people about that. I think you have a
Okay.
lot of good advice and a hell of a story of what you went through.
Yes,
And
unfortunately.
it may help a lot of people. And of course, you're a registered
Yeah.
nurse too, so you have a medical background, and we can talk some
Yes.
about that at the end. So you have a very unique perspective, I think, on your accident, and you know a lot from the medical side about it.
Yeah, unfortunately.
Yeah,
Yeah,
yeah.
definitely. Knowing what's happening, well, I guess we'll just get into the story and then
Yeah.
go from there. Okay, so I was in my mid-20s, and that's whenever I was actually working for a home health care agency. So I would drive to people's houses and see them, give them nursing care. And I was actually in Coleman whenever this happened. And I had just seen a patient and I was leaving their house. And then I had like a weird sensation. So I was driving and I just felt off. It almost feels like, I don't know if you've ever had this happen, but like when your blood pressure, or not your blood pressure, but your blood sugar is low, you start getting a little bit shaky
Yeah.
and feeling a little bit woozy. And so that's what it felt like. And so I thought my blood sugar was low. And I hadn't really drank a lot of water. I'm just notorious for not drinking enough water. And so I didn't think anything of it. So I was like, all right, I'm just going to, just tough it out. I tried to get from Coleman back to Brownwood. It was my last visit of the day. I'm going to get back and I'll just hydrate and pick up my baby, hydrate, and then just relax and it'll be better. And so I did that, or I was planning on doing that, but I didn't even get down the road. And then all of a sudden, things got progressively worse. I called my sister at the time, and I just told her, I was like, look, I'm not feeling good. Like, I just need to talk to somebody. I'm on my way back right now, but I just felt uncomfortable with, going by myself.
Mm-hmm.
Well, I mean, I was still by myself, but, like not having anybody on the phone with me. And so I called her. I told her how I was feeling, and she's like, okay, well, let me know if you, she's like, I'll stay on the phone with you and, just let me know if it gets worse. And it did get worse. So all of a sudden I was driving and all of a sudden my vision goes out. And what
It's
happened?
terrifying.
Yes. So what happened was I could see everything normally. Then all of a sudden, it's like my vision went upside down. So everything was upside down, but I knew I was sitting up because I could still like have a sense of direction, but everything was upside down. So the first thing I did was to kind of go on the side of the road and to put it in park. And then right when I had thankfully put it in park with this arm, which is my right arm, my left side, my entire left side went numb and stopped working. But I didn't realize it had stopped working. I just realized I was just, sitting up and then I just kind of fell over and I was just like, I'd already put it in park. And then I was just like, what the heck's going on?
Thank God you were safely stopped. You were
Yeah,
able to
yeah.
do that.
Yeah, and it was just like not even really on the side of the road. I just kind of like went off a little bit, pushed in park real quick, and then just kind of fell over. And then after that, just projectile vomiting everywhere. Like I could not control it. And so I told my sister that I needed to call the cops. And so I got off the phone with her and I called the ambulance. I told them where I was at and I told them that, I needed help. And so they sent somebody out. It didn't seem like it took very long. I was honestly right down the street from the hospital. But I don't have really a lot of perception of time for that time frame that was happening. I don't think it lasted very long. By the time they got there, was able to open the car door and I was kind of slumped out of it, just kind of puking because the whole time I was like, God, I don't want to puke inside my car.
Mm-hmm.
And so I had opened it, and then all of a sudden, like right when as they were coming up, I was able to move my arm again.
Yeah.
And it's like just normally.
Yeah.
And so I was like, okay, like whatever it was passed. Like I don't know what that was. I just felt dizzy.
Is everything still inverted at this point? Everything's still upside down, or is it back to
No.
normal?
At this point, the vision had corrected itself.
Okay.
Like my feeling had come back.
Okay.
Then the ambulance had gotten there, and I told them, I was like, I think it's my blood sugar. So they checked my blood sugar. They're like, no, it's fine. And I was like, I have no idea what could be causing this. I didn't really take medications at that time. So I was just like kind of stumped at that point. But I noticed I was sweating a lot. I was diaphoretic. And so it just drenched in sweat. But it's like, it's in the summer in Texas. It's not.
So you're like, is it just super hot out here? Or
Yeah.
what's going on? You're kind of in between. Is it a medical issue or just both?
Yeah, exactly. And so then she asked me, she's like, do you usually sweat this much? And I'm like, I actually don't sweat at all. Honestly, I don't.
The body doesn't cool itself ever.
Yeah. I'm like, I don't drink enough water half the time, so no, I don't sweat at all. And but I mean, it seemed like almost everything resolved. But I told her that I could not open my eyes because if I did, I would projectile vomit because I had no sense of where I was at still. So I knew if I opened my eyes, I could see regularly now. Like I could see things were, at least not upside down. So that was good. But I told her, I was just like, I can't open my eyes because I'll projectile vomit everywhere. And so she said, okay. And so she took me to the hospital and I was just kind of laid up there. They did some blood work and they asked me if I did drugs and I told them no. I mean, I was in my nursing uniform and I had my badge on me. And so I'm like, look, I'm a nurse. Like, I'm not doing drugs while I'm at work.
Pretty crappy. They automatically assume that
Yes.
just when someone has an issue instead of treating it like a real medical issue. And is this the cops or paramedics at this point?
Paramedics. The cops were
there
too.
Paramedics ask you that.
Yeah. And then the cops had shown up too, and they're very nice because I was right down the street from the hospital, and I was just like, look, I really don't want to have to pay for my freaking car to be towed, or whatever it was. And so they were really nice. They actually cleaned my car and then parked it.
They cleaned up the puke, right?
Yeah.
You tell me that. That's extremely nice of them.
Yeah, so they were very, very kind. So that was Coleman PD. And then they
good for them.
Put my vehicle in the hospital parking lot. So
okay.
I thought that was very kind of them. So that at least I wasn't worrying about that whenever everything was going on. But yeah, I got in there. They had called, I was married at the time. They had called my husband at the time and he showed up there. They at first suspected I was pregnant, but I had just had a miscarriage like maybe 6 months before. So I'm like, that's not even anything that's, not possible right now. And then they asked me about the drugs. They were just like really pressing on that. And I kept telling them, look, I'm not on drugs. Everything came back and it was clear I wasn't on drugs. They told me they had to get a urine sample. And I just didn't think that they were taking me seriously because whenever I was telling them that I couldn't open my eyes because everything was just completely like I couldn't tell where I was at and everything was just spinning. I feel like right then and there, they just blew me off. Mm-hmm. They could not fathom that would happen to anybody. And I think they just thought I was crazy at that point. And that's kind of the treatment that I got. So I felt frustrated. I felt alone. And then I didn't have really anyone to advocate for me. My parents weren't there. And then the person that I was there with wasn't somebody that I could say that I trust with my life, And so it was just really difficult at that point. But I stayed there. They asked me for a urine sample. So I got up and she told me, she's like, you're going to have to open your eyes so you know where you're going. So I did. I was like, okay, fine. I'll open my eyes. I opened my eyes, immediately projectile vomiting everywhere.
Every time you opened your eyes?
Yeah. So she saw me puke everywhere.
Yeah.
And then
it was running out of body liquid to get rid of.
Yes.
Like dry heave.
It was so much that she was just like, we could barely even get the urine sample. And I'm over here trying to freaking pee to get a urine sample while throwing up all over the place. And it was just a mess. And then I was just so embarrassed. And then so they eventually put me back in bed. And then they're like, okay, well, she doesn't have a urinary tract infection. All her blood work comes back good. She's not on drugs. And so the only thing they could tell me after hours and hours of being there, and I couldn't really communicate either. Like I was just so busy, like focused on not throwing up that I couldn't even really communicate or do or say anything. And I was a little bit confused.
Of course.
But the whole time I was thinking inside, like my brain is still able to communicate with itself, And so the whole time I was thinking like, I have a brain tumor and there's like increased intracranial pressure and this is why I'm vomiting everywhere.
You being the nurse is
yes,
driving
or
you
all
nuts, like your
sorts of
anxiety.
stuff.
Yeah.
Yes. And then so I told her, I was just like, do something else, you know, and they just refused to. They said, you know, we think you have a stomach bug. And, you know, after they accused me of freaking doing drugs,
You're already kind of pissed off.
yeah, so that was already like the last straw, you know.
Just
and then
lack of care and neglect, really. I mean,
yes, and it's just like
crappy.
I'm in my uniform. I'm telling you, you know, and I couldn't communicate
it's not like
very
you look
well.
like you're on drugs. I mean,
yes, exactly. Well, I was pretty skinny, so I'm like, I don't know.
They never
they
know.
I'm like, I guess that's what they went off of.
Yeah.
But I mean, I just obviously wasn't acting like myself. And then, you know, at the end of the day, it was already night. Like that happened around 3:00 in the afternoon.
Mm-hmm.
It was probably already 6, 7:00 at night. And then they were discharging me. And I still had my eyes closed, laying in bed. And then they're like, okay, you're good to go home. And I was like, what? And they're like, yeah, you're good to go home. I'm like, I still can't see. And I'm like, how are you going to let me go home like that?
They wanted you to drive yourself home?
Well, I had my ex-husband there with me.
Oh,
at
yeah.
the time, he was my husband.
I got you. Yeah.
And so I was just like, look, y'all can't send me home like this. Like, I can't see. And then they were just like, well, then you need to open your eyes. And I was just like, but when I open my eyes, I projectile vomit everywhere. I was like, y'all need to do more testing.
Mm-hmm.
You know, this whole time fighting not to throw up, even talking to them, still a little bit confused. You know, obviously you're having a freaking stroke, you know, you're going to be a little bit confused. It's like I couldn't, like I knew everything that I was thinking in my mind, but it was just so hard to get it out. And so I just was in tears at that point. I just broke down crying. I was just so frustrated. And I was like, y'all can't do this to me. Y'all can't let me go home like this. I'm not okay. I can't see. And all they did was bring up a wheelchair and they wheeled me out because I told them I can't even walk. And they're like, well, because, you know, I was just so dizzy that opening my eyes would have definitely made me throw up. But even walking, like, I just feel like I didn't have really a sense to walk. Like, I just felt out of it. And so they're like, you know, basically acting like I'm being dramatic and I'm crazy. And then they tell me that I have a stomach bug and that's why all this happened. And I was like, that doesn't make sense. That's the stupidest thing I've ever heard.
Out of all the crap they could come up with.
Yes.
Stomach bug.
I was like,
all those
you're
symptoms.
literally telling me this is a stomach bug.
Yeah.
I was like, the audacity. You know?
And they're healthcare professionals too.
Yes,
that's
like,
what's scary.
Yes, and so I was just like, I'm here in the emergency room. And I was like, not only that, it's been 4 hours, and I never once at that point, I don't remember ever thinking, oh, well, this is going to be, you know, a stroke. I honestly thought it was maybe like a brain tumor that was causing increased intracranial pressure, and that's why I was projectile vomiting. And so I was like, well, you know, I can just go somewhere else or do something else. So I told my husband at the time, I was like, look, they're not correct. What they're saying is not correct. Will you please take me to another hospital? And he flat out declined that. He told me, he's like, look, you're not a doctor. You don't know what you're talking about.
But you're a nurse. Like, that's what you do
And
for
I
a
was
living.
like,
oh,
granted,
God.
I'm not a doctor. I'm like, but look, I'm telling you.
No support there.
Yes. So there was no support with that. I was in tears. I drove back all the way to Brownwood. They give me nausea medication. I'm literally puking the whole way. Nausea medication doesn't work. You know, at that point, he had picked up my baby. And so.
How old is Nico at that point?
He was probably like 3 or 4.
Okay.
And so, yeah, he took him, you know, to the other room and just left me in a room by myself where I puked all night. And then the next morning, I still couldn't see. So then I told him, I was like, you know what, like, let's call the doctor. I need to get seen by somebody else. And so then she immediately heard the symptoms and told me to go to Hendricks. And then that's whenever I went to Hendricks. And I don't really remember a lot of it. Everything was still a little bit cloudy. And so then when I went in, they said my admitting complaint was yesterday, I had a stroke yesterday. So I was repeating words. And I literally told them I had a stroke. I do not remember that because I was so out of it. So that's how I knew, like, I must have been out of it if I didn't even remember that. So that really made them take me more seriously.
Yeah.
But after doing their workup, like I started being able to move more, and then I wasn't throwing up anymore by the next morning. I was actually able to open my eyes while I was at the ER. Was the first time that I attempted to open my eyes, and I was able to, and then everything was going back to normal. So it honestly looked like I was just like fully recovered all of a sudden. But I told her, I was like, look, I was messed up for quite a bit of time and it was pretty bad symptoms. I'm like, y'all need to look into this. And so, because I had told them I had a stroke, and then I had called my sister and she said my speech was slurred, then that's why they decided to do an MRI. But they had told me that they thought it was crystals in my ears. And that's why I was having issues with my balance.
That's extreme case. Like nobody has that many symptoms from that, do they?
Well,
It's not that bad.
Not any of the numbness and everything. And at that time, I couldn't even recall the numbness.
Yeah.
At this point, I'm just really confused. And so when I went in, I told them that, and I talked to a neurologist, and she was super sweet, and she was extra cautious. She said, you know what, I'm going to do an MRI and an MRA just in case. But I think you should be good. So we're just going to do that. Everything comes out good, then you're good to go home. Yeah. And I said, okay. Literally, go get that done. Right after I get that done, I'm in my hospital room, and there's just people running in, just everywhere. Nurses are running in like there's an emergency, and I'm just like, oh, where are they running? And then I'm like, oh shit, they're running at me, you know?
This is at Hendricks and Abilene.
Yes, yes.
So much better care there.
Yes, overall. They all ran in there. They were hooking me up, and then I saw that they had some heparin, and I was like, "Oh no!"
What's heparin for?
It's it's like a blood thinning medication. So if you have a blood clot or anything like that, they give you that. Yeah. And so with a stroke, you only have a 4-hour window. So if you have a stroke, you only have a certain amount of time to give a blood clot buster.
Okay.
Okay.
Yeah, we talked about that a little bit earlier.
Yes.
It saves people and keeps them from having major damage from the stroke.
Permanent damage, yes.
Yeah, permanent.
So you have to get a clot buster as soon as possible. Obviously, it had been over 24 hours for me. That wasn't an option for me. So they gave me the heparin. Apparently, I had a pretty big blood clot. And what had happened was I had an artery tear in the back of my vertebral artery on the right side. And so that
run up your spine?
No, it's on my neck. So it's like
it's
back
on your
here.
Neck. Okay.
Yes. So it's one of the arteries that supplies blood to the brain. And so there's, of course, your carotids, and then the vertebrals are the ones in the back.
Okay.
And so the vertebral one was the one that I had dissected, and that's the one that supplies blood to the cerebellum, a lot of the stuff in that area, and actually to your brainstem. So that's actually one of the worst places that you can have a stroke, because it's so close to the brainstem that, I mean, if it hits you in the brainstem, you're done.
Gone. You're very
done.
Fortunate that didn't happen.
Yes,
even as bad as it was, that wasn't.
Yes, I'm very fortunate that did not happen. But that's why, like, some people don't have any symptoms. Well, they have symptoms, but not any, like the left side being numb. Some people don't have that. That happens because it's just the cerebellum is the part that it actually hit. So it was more just that area, and that has all to do with balance. But then, I also had the vision problems, and then I also had the numbness and inability to use my left side. But like I said, that resolved quickly. By the time the ambulance got there, I was able to move it again. And I was very, very confused at the time. So they told me that I had a blood clot, and I had another one in there as well. So they needed to get me on heparin immediately so I wouldn't have another huge stroke.
So does the MRI pick that up?
Yeah.
Okay.
And the MRA views the arteries. Okay. And I was very, very fortunate to have had that study done as well, because it was able to, show me that, or show them that. And it was just one of those things that you never think could happen. And by that time, I tell you, by the time I went into Hendricks, like, I was able to see again, and I was able to walk, and I felt perfectly fine. And then that's whenever they ran in there and they said that I had another one, and they were just putting me on all sorts of medication. And I stayed in the hospital for a week, and I honestly felt perfectly fine. It wasn't until afterwards that I started having a lot more symptoms, which is strange. But I guess once you start trying to get back to your regular routine, you notice a lot of the deficits.
So before you get into that part, you said you had been on the phone with your sister.
Yes.
Was it your twin or your older sister?
It was my older sister. She's like my second mom.
Yeah.
So
Were they freaking out?
Yes.
Like what happened? What did they do? Did they end up coming to the hospital when you first went in?
They didn't.
That seems like it'd be terrifying as a sibling to have your sister on the phone, like, "Hey, I don't know what's going on with me. I'm driving."
Yeah, I told them. I told her, and then I told her I was like, "I'm going to get off the phone with you to call the ambulance." So I called the ambulance, and then after I called the ambulance, I called my then husband, and I told him what was going on, and he said he was gonna.
Gotta have that disclaimer. Then.
Yes, and then I was like, okay, well, he's gonna come down here. So they were like, okay, he's gonna handle it. They never once in their minds thought this could be something that serious. I told them I thought it was just low blood sugar. So that's not really anything to freak out about.
Yeah.
And then whenever he had spoke to them, he downplayed everything because he didn't really think that was actually what was going on. But whenever all that was happening, the vision changes, the left side going numb, and I was confused. I felt like I was dying. Like I knew it.
You were pretty certain of it.
Yes,
like you ran all these scenarios through your head, I'm sure.
Yes, like I, in my mind, had no doubt that I was dying. And I was just thinking the whole time, like, what about my kid? It's very hard
as a parent, that's the first thing you think about is what's my kid gonna do?
I was like, what was the last thing I said to my kid? Like I remember I dropped him off at daycare. I always gave him a kiss, but I was just like not in the best, marriage at that point. And I was just like, I can't do that to my kid. Like,
you don't want to leave your kid with that other half.
Yes, that was like an immensely terrifying
It is terrifying
realization. I was just like, and then I just had like, people say that whenever they have near death experiences that their whole life flashes before their eyes. And that is exactly what happened for me.
Yeah.
Exactly.
That's what's crazy. And we've talked before about parental rights. Like if the other parent is just shitty and the kid would be a lot better off with your parents or one of your sisters, it's so hard to get that taken care of in court to where the kid doesn't automatically go to them. And we won't go down that path, but I can relate to that fear. There's been times where I can directly relate to that fear.
Yeah, so at that moment, all I did was pray. I was just like, God, please, like, I got to be here for him. Like, this is the best path for him. I cannot imagine life with him just being with that other person that has all these issues. And I'm like, I have to be there for him. I have to make sure that he's brought up correctly and that he has the best chance to be successful in life. And then it's funny because I actually, like my life flashed before my eyes. I thought about my son and then I thought about my parents. And I think that's what really tore me up was thinking like, I can't do this to them. Like I can't break my parents' heart.
Because you're so young too.
Yes. Yeah. And I'm like, this would literally kill them, which is kind of like when I thought about it later, I was just like, there I was worrying about everyone else except for myself whenever it happened.
I hear that a lot with people that have near-death experiences though. They're so worried about how sad everyone else is going to be that you just don't really care about your mortality aside from that. Like you're not worried about you.
Yeah, definitely not. Never once did, I crossed my mind, like I would have just been fine. You know what I mean? And so whenever I was thinking about all that, I don't know, I had no concept of time really at that point. I don't think it took very long. I know that the ambulance lady said that it was right down the street. So we got here quickly. But it seemed like ages whenever I was there. It seemed like just thinking about everything, like time stood still and I was able to think about my entire life in those few minutes that I was there.
Every second feels like a minute. And
yes.
I think I hear a lot of stories. I've never had near death, but that almost, if something kind of proves like divine and God, I think that kind of ties in there. That example, you just flash back and rewind everything and just process it.
And I was very scared. And then I was just like almost breaking down, just thinking about how this would hurt my parents. And then all of a sudden, like I had this feeling of like peace. It was like I was so at peace. It was just, I had no worry in the world. And I was just like, everything's going to be okay. And then they showed up. And I was just like, so crazy because I just, at that point, my body was telling me everything's going to be okay. And then I got healing back in and everything. So, I mean, a lot of people see that and just, make their own explanations for it. But for me, I'm a religious person. So to me, that was God.
Yeah.
And that's why I have faith and why I lean into my religion a lot, because I feel like that's what that was at that point.
People that experience stuff like that and they have a story behind it, like at that point, it's it kind of validates it. It's not just kind of wishful thinking that there's something out there. Like you've had an experience that, and God has touched you somehow to where you believe in it. And it's not just listening to somebody preach in church every Sunday and just buying into it.
Yeah, exactly. Yeah. And at that point I had kind of strayed away from any kind of church or anything because I was in nursing school prior to that, and it was like a full-time job. Like I went to nursing school in Sweetwater, I lived in Brownwood, and I did all my clinicals in Abilene.
Yeah.
So it was a full-time job doing all of that.
Yeah, it's a lot of work. I've told you before, I was originally going to be a nurse, and then I saw the workload with clinicals and trying to work 50 or 60 hours a week anyway and put myself through college. There was no way I could do both. And then I picked business, and it worked out well for me anyway. But yeah, it's a lot of work.
It is a lot of work.
We'll take a break here in a second, and then I think you're going to take back off before we start talking about your sister on kind of how you progressed downhill after that.